Hello everyone, this is Sumant Raj, third year BDS at RV Dental College. Today I am going to talk about oral health education for tobacco cessation for the youths. Tobacco use is described as the single most preventable cause of morbidity and mortality globally, with the World Bank predicting over 450 million tobacco deaths in the next 50 years if the present scenario doesn't change. US Surgeon General has said that smoking cessation represents the single most important step that people who smoke can take to enhance the length and quality of the life. In India, 47-70% of males and 14% of females are addicted to tobacco. There are about 194 million users of both smokeless and smoking forms. Annual oral cancer incidence in the India subcontinent has been estimated to be as high as 10 per 1 lakh among the males. We will see what are the benefits by cessation of tobacco. Aggressive tobacco cessation measures result in several benefits that have been well documented. It has been estimated that approximately 180 billion tobacco related deaths could be avoided. Cessation of smokeless tobacco use is associated with a reduced risk of oral cancer and precancerous lesion, cardiovascular diseases, and dental problems. And it can also avoid the risk of lung cancer, coronary heart diseases, and the chronic obstructive pulmonary diseases are also markedly reduced by smoking cessation. If potential mother quit the smoking before becoming a pregnant or within the first trimester of the pregnancy, infant's birth weight is likely to be as a non-smokers, means a normal persons who doesn't smoke. Smoking cessation also causes favorable changes in lipid profile and body fat deposition. Tobacco use has negative social consequences. It is expensive. You could be spending your money on many important things. Smoking reduces your fertility. When you buy a tobacco, you're financially supporting an industry that exploiting farmers and children's pedal sickness and death. Tobacco causes over 20 types of cancer. I'm requesting the youth who are addicted to tobacco, please get rid of that and avoid future problems. Now we'll see about what are the barriers to quitting. Poor knowledge of risk of smoking has been shown to be associated with the smoking initiation among the school and college students. Other barriers is lack of tobacco cessation advice and support. Recent study in India report that 83% of tobacco users wanted to quit, of whom 51% was unsuccessful. Health providers may also lack of motivation to undertake a smoking cessation activities. Effects towards the tobacco cessation. The efficacy of an anti-tobacco committee education program was evaluated in Karnataka after 2 years in case control design. Annual age adjusted rate of leukoplakia also decreased in the group at 8 to 10 years follow-up. Leukoplakia means white patches or plaque that cannot characterize clinically or pathologically as any other diseases and which is associated with any physical or chemical causative agent except the use of tobacco. A study carried out in a Vaishali district of Bihar used potential volunteers groups and individuals in the community and trained them teams to provide a cessation activities. The intervention led to a 4% quit rate, 3% dose reduction rate, and 2% of reduction in multiple habits. A study concluded that the community centered mass approaches with a minimal sustained intervention was more effective than the clinic centered intensive and individual approach. What can we do behind the clinic? Expansion behind the clinic, tobacco cessation training, and incorporation of tobacco education into a training curriculum, establishment of tobacco quit line that offers a free counseling and resource to quit, integration of tobacco cessation into existing programs. Every clinical consultant must become a teachable moment for behavioral changes, advertise the benefits of tobacco cessation and the facility for the support. Using tobacco cessation is not unique, just individual, but in a group and the community setting. I'm going to conclude that given the high global morbidity and mortality from tobacco in India, this is aimed to develop evidence based cost effectiveness intervention for both smoking and smokeless tobacco use. Tobacco addiction produces a neurological and behavioral changes, and optimal approaches combining behavioral methods and pharmacotherapy needs to be developed. Thank you.